Keeping an eye on your health now, it is Endometriosis Awareness Month, and it is often a painful condition that can affect millions of women nationwide, but you might not know a lot about it. So joining me now to get a better understanding of endometriosis is Dr. Jeff James. He's a gynecologic oncologist. So Dr. James, thank you so much for being with us this morning. First and foremost, what is endometriosis?
Endometriosis is when the tissue that normally lines the uterus, which is called the endometrium, is in a location that it's not supposed to normally be, outside of the uterus, in the abdominal cavity, in a location that it is outside of the normal lining of the uterus.
Okay, and so what might be some of the signs and symptoms, and how is it diagnosed?
Great question. So a lot of the signs and symptoms are heavy periods, irregular periods, pelvic pain. It is typically diagnosed definitively by laparoscopy or surgery that looks inside the abdominal cavity and actually can see in biopsy the endometriosis or the endometriotic implants.
Sure. You know, a lot of women who want to become mothers might be concerned about endometriosis. So how might this impact their fertility?
Sure, it does impact fertility about 50% of the time. It can decrease the ability to get pregnant. Sometimes that requires surgery to improve the scar tissue or adhesions that can occur from the endometriosis, or procedures that actually open up the fallopian tubes. It definitely can have an impact on the ability to get pregnant, though.
So is endometriosis a sign that you cannot get pregnant, or is there still hope for women?
There is absolutely still hope. So that's where the surgery oftentimes will come into play in order to improve the ability to get pregnant if there is difficulty.
Sure. So let's say a woman is diagnosed with endometriosis. There's probably going to be a little fear for them, but what are next steps? Like, what should a woman do?
Definitely getting in to see your OBGYN to start the workup. I and my partners in practice don't typically see endometriosis patients until they're more refractory or the initial treatment mechanisms haven't worked so well. So the primary OBGYNs are really great at diagnosing these, at doing the first-line treatments and therapies for them. And then if things are a little bit more advanced, then they might end up seeing somebody like myself. But getting in to see your primary care doctor, your OBGYN, certainly would be a very good first step.
Always a good sign to just talk to your doctor, talk to those in healthcare that you trust. Are there anything that we women can do to reduce the risks?
No, unfortunately, there isn't. You know, we don't have an exact mechanism of how this happens. There's a couple of different theories, some that are stronger than others, but there's really nothing that you can do to reduce the chance that it does occur.
Sure. All right. Well, a lot of great information from you, Dr. James. So thank you so much for being with us here on CBS News Colorado. And remember, you can watch all of our health interviews right now on CBSColorado.com.